Good afternoon, and thank you for joining us for this community briefing on COVID-19. And thank you once again to Margie Prop for being here to provide your interpretation services. Time and again during this pandemic, our community members have answered the call to care for one another. You've worn masks, you've worked from home, you've put physical distance between yourself and others, you've washed your hands until they're dry and cracked. And you've done it all in service of the greater good, and for that we are really thankful. Others have noticed and joined you. Other cities from across the state have joined our community and put mask requirements in place when the data proved that these measures lowered case counts and reduced positivity rates. Our collective efforts matter. Our fates are intertwined, and the virus has shown us just how interconnected we all truly are. To everyone near and far who is stepping up to help protect their loved ones, their neighbors, our healthcare workers, our educators, and our first responders, thank you. To everyone who is diligently practicing the 3 W's and avoiding the 3 C's to save lives, protect businesses, help keep our kids in school, and prevent our hospitals from becoming overburdened, thank you. Even with our admirable and robust collective efforts, we still have gaps in our defense against this destructive virus. We are only as strong as our weakest link, and there is still more we can do to claim power over this virus. We must remain vigilant. With the degree of community spread we are currently experiencing, the odds are that someone in our close circle has the virus. Consider this. If you gather in a group of 10 people in Lancaster County, there is a 37% chance that one person out of those 10 has the virus. If you were to gather with 25 people, the chance that one person has the virus is 67%, which is why our directed health measure prohibits this in an effort to help stop the spread. The severe risk of transmission that we currently face is why our community remains in the red area of the COVID-19 risk dial for a 5th week. Since the beginning of November, we have continued to see our key indicators worsen. In fact, November proved to be the worst month of the pandemic thus far in Lancaster County. In November, we saw 7,186 cases, new cases, or about 40% of all cases. We lost 34 members of our community to COVID-19. That is 40% of all COVID deaths locally to date. We also witnessed the highest number of hospitalizations and the highest positivity rate. It's clear that we still continue to have a critical situation as we deal with the uncontrolled spread of COVID-19 in our community. And while we can't undo those November numbers and the impact they're having on our community and this outbreak today, we can take action now to reverse these trends and put ourselves in a better place as we welcome the new year and the hope that new vaccines bring. What are these actions? We must continue to minimize contact with others from outside our households, as hard as that is, and avoid unnecessary activities outside our homes. We must wear our masks, stay at least 6 feet from others, and wash our hands frequently. Work from home if possible, and only visit businesses or participate in activities that follow public health guidance. Older adults and those with underlying health conditions and others at increased risk for COVID-19 need to stay home, rely on others for needs from outside the home, and stay at least 6 feet away from other household members who work outside of the home. These public health strategies remain paramount, even with the promise of a vaccine on the horizon. Until the day that a high percentage of our population has been vaccinated, the virus will continue to find its way through our defenses. The virus will remain deadly and still seek to take the lives of our friends and neighbors. We all must continue to do our part to prevent further illness and death, as the statistics we share in these briefings are not simply numbers. They are someone else's loved one. They may be your loved one. Which is why today we regret to announce 2 additional community member deaths, bringing our total to 92. So far this week, we have lost 19 of our community members to COVID-19, a new weekly high. Once again, we extend our condolences to the friends and families of all those who have lost a loved one to COVID-19. Health Director Pat Lopez is here now with more to share about our key indicators and with more information regarding changes in our local directed health measure for Lincoln and Lancaster County.
Thank you, Mayor. I want to begin by showing how our key indicators have continued to worsen during the month of November. All have more than doubled. At the end of October, the 7-day rolling average of new daily cases was 124. By the end of November, the average had increased to 278. That's a 124% increase. At the end of October, the weekly case count was 890. By the end of the last week in November, we were up to 1,876 cases a week, an increase of 111%. At the end of October, the weekly positivity rate was 13.3%, but by the end of November, the rate was up to 29.6%, an increase of 123%. And the number of daily COVID-19 patients hospitalized was 84 at the end of October. At the end of November, the number of daily hospitalizations was up to 172, a 105% increase. As of this morning, 87% of all staffed inpatient beds are occupied in 3 hospitals. This chart that shows the increasing number of cases illustrates the severity of our situation. New COVID-19 cases remain high. Today, we are reporting another 418 community members that have tested positive for the virus. Our weekly total so far is 1,704. Our overall total now is above 18,000, actually 18,001. Our weekly positivity rate is extremely high. So far this week, we are above 35%. Today, we are reporting 140 COVID patients with 9 on ventilators. 82 are from Lancaster County, and 58 are from other communities. In the past week, we have seen some of the highest daily hospitalization numbers among our Lancaster County residents. On Tuesday, December 1st, there were 98 Lancaster County residents that were hospitalized. That's the daily high. In mid-November, the majority of our hospitalizations were residents from outside Lancaster County. That has now turned around. In the past 3 weeks, we've also seen the highest number of cases being reported among our long-term care facilities. Information presented to the state this morning that shows that most of the long-term care residents are seeking end-of-life care in the facilities rather than at the hospitals. To get this pandemic under control, we need large-scale cooperation. We need to do this together. Slowing the transmission of the virus requires a significant shift in behavior. It is not just about protecting yourself. It is about protecting each other. We continue to stress that one person not following precautions can impact our entire community, putting others at risk and stressing our healthcare system. We've all heard a lot about the COVID-19 vaccine recently. The information keeps changing, but I want to share what we know right now. First, the good news is that we are getting closer to having the first doses arrive here in Nebraska. The state reported earlier this week that if approved, a very limited number of COVID-19 doses could be allocated to the state as soon as the week of December 13th. We have been working with our Community COVID-19 Vaccine Advisory Committee and many other partners for months now to plan and prepare. The vaccine will give us another critical tool to stop the spread of the virus, and we encourage every resident to get vaccinated as soon as vaccine is available to them. It's important to know when these vaccines are available that they will be as safe as possible. The development of the vaccine includes rigorous clinical trials involving tens of thousands of people, as well as a comprehensive FDA evaluation. These were some of the largest clinical trials that have been carried out on a drug. Once the FDA approves a COVID-19 vaccine, the Advisory Committee on Immunization Practice will conduct its review and then decide whether to recommend the vaccine to CDC. While the process of vaccine development and approval has occurred much faster than normal, there were no shortcuts taken in the evaluation of the safety of the vaccine. Advancements in science, significant investment by the federal government in vaccine development, and the very large clinical trials I mentioned have made this possible. Here is a brief snapshot of two of the COVID-19 vaccines that are up for approval first. Early on, we will have a limited supply of vaccines, so we will use a phased approach. Initial doses will be offered to healthcare personnel and staff and residents of long-term care facilities. As vaccine supply increases, it will be offered to first responders, correctional staff, adults 65 years of age and older, and those with underlying medical conditions, our school personnel, incarcerated individuals, and individuals experiencing health inequities, as well as essential workers. As more doses come into the state, more people will be able to receive vaccine. However, the COVID-19 vaccines may not be authorized for use in children until the fall. We will continue to share vaccine-related information as it becomes available. We also wanted to update you today on the new CDC guidance related to quarantine, which is also an important tool for those who have been in contact with someone diagnosed with COVID-19. Quarantine prevents the spread of disease by keeping a person who might have been exposed away from others. As new information and research becomes available during the pandemic, we have continued to make adjustments to our recommendations. The science is now showing that a shortened period of quarantine, along with other measures, can also be effective in reducing the risk of transmission. The CDC still recommends a quarantine period of 14 days, but the agency has added 2 acceptable processes to shorten the window for quarantine. Quarantine can end after 10 days without testing and if no symptoms have been developed during daily monitoring. The individual must continue to wear a mask and monitor themselves through the 14 days. Quarantine can end after 7 days only if all the following 3 conditions are met. The person seeks a COVID-19 test on day 5 following their exposure to another person testing positive and the test is negative. The person is not experiencing symptoms and the person continues to self-monitor for COVID-19 symptoms and wears a mask through day 14. During quarantine, exposed individuals should watch for a fever of 100.4 or greater, cough, shortness of breath, or other symptoms. They should also stay away from others as much as possible, especially from those who are at higher risk for complications. Those who choose the shorter quarantine option should continue to monitor symptoms and take protective measures like wearing masks through day 14, even when they are at home. More information on quarantine is available at covid19.lincoln.ne.gov. The website also has information on isolation, which is a tool for those with COVID-19. Decreasing the spread of the virus has been the focus of our local directed health measures. Decisions on the directed health measures are based on the latest science, best practices, and evidence-based data, along with input from our stakeholders and community partners. Ultimately, the authority resides with the health director to enact measures necessary to prevent or minimize the spread of the communicable disease. Yesterday, we announced that the 3-week postponement of youth sports and activities ends Monday, December 7th. The decision to delay youth sports and activities for a few weeks gave us urgently needed time to identify solutions for how we may more safely conduct youth activities while we are in red. In other words, while we are at the period of the most severe risk for COVID-19 transmission due to the record high levels of community spread we are experiencing. While young people do appear to be less likely than adults to suffer severe complications from the virus, our greatest concern continues to be that young people can pass the virus on to others who are at greater risk. We have seen this kind of spread associated with sports in our community and in Nebraska and other states. With wide community spread, we know the risk that one or more participants in these activities may have the virus, and that is substantially greater than it was several months ago. Most schools, organizations, coaches, and participants support the intent of that pause and have used the time wisely. We've worked with them to reevaluate, strategize, and prepare for a return. I want to again thank all of those who worked with us on resuming these activities as safely as possible. The 3-week pause and the productive discussions we have engaged in during that time have been crucial steps in reducing the spread of the virus. Starting Monday, those who operate, coach, or supervise K through 12 extracurricular group activities, as well as facilities that host these activities, are now required to submit an extracurricular activity plan to the health department. The plan must include this information: specific actions to reduce the risk of the spread, including illness monitoring and exclusion, masking and physical distancing, as well as plans for cleaning and disinfection. Strategies must also be included for communicating the COVID-19 process and procedures to all of those involved. Strategies for ensuring that everyone wears masks and practices physical distancing during all rehearsal practices and competitions. This could include progressive warnings, stopping the activity, and removing those who do not comply. Information on how seating will be managed to comply with the DHM requirements. We must also know how attendance records for all activities will be maintained, and how the health department and participants will be notified when someone has been exposed to the COVID virus. A template, sample plan, and guidance document is available on the business resource page at covid19.lincoln.ne.gov. Our health department staff will review plans quickly to allow extracurricular activities to resume once the plans are approved. Those who have questions on developing the plan can contact the health department at 402-441-6280. In addition, all those associated with the activities have a social and moral responsibility to report symptoms of COVID-19 and get tested. Anyone who is sick or has symptoms must stay home, and those who test positive should not return before isolation and the required protocols are completed. It is imperative that parents and guardians, as well as all those involved in the activities, follow these protocols to reduce the community transmission of the virus and to allow these activities to continue.
Thank you, Director Lopez. I want to echo Director Lopez's appreciation for all those who have collaborated with our health team over the past 3 weeks to find a better and safer path forward for youth sports and activities. And now it is my pleasure to introduce two of our community's educational leaders who are here today to share their perspectives. Today we have both Dr. Steve Joel, our LPS superintendent, and Principal Tom Corda from Pius X High School. And first we'll hear from Dr. Joel.
Thank you, Mayor. Appreciate, as always, very much the opportunity to respond to the great work that's taking place within our city as we continue to battle this virus. And please know that from an LPS perspective, we appreciate all the hard work of the health department and the health department team, as well as the folks that are involved with us at the city level. And Director Lopez mentioned, and I want to underscore, the communication that's been taking place from day one, back in March, when we first found out that we were going to be dealing with this challenge. The communication has been weekly, if not more, and so appreciate very much that before major decisions are made, we have an opportunity to provide input, and we have on this one as well, too. So thank you, Director Lopez, for your diligence and for the work of your team. We continue to believe that schools are safe, at least as safe as we can make them. Our teachers and our sponsors and our coaches and our parents are following protocols. And with the ability now to get back into the arena or to the gymnasiums and the various other competitive locations, we intend to follow these protocols very diligently. And we understand that they've been strengthened so that we can add an additional layer of safety to them. We will report when students come down with the virus. And we'll continue to work very, very closely with making sure that our plans are the safest as possible. And we know that this 3 weeks is very difficult for our students and very difficult for our parents and difficult as well for, I'm sure, our coaches and our sponsors. But we did support the directed health measure because we always want to do our part to be able to drive down the numbers to the degree that we can. But we also know that sports and activities keep kids in school and keep them engaged and help them perform better academically. So we're grateful that we're going to receive an opportunity to get back to this. We will, as I said before, we will continue to work with our students, our staff, our families to make sure we're following the health department's recommendations so that we can continue to offer these activities to our students. And we will continue to monitor with the health department and adjust as necessary. Thank you again to our community for all of their efforts to help reduce the spread of COVID-19, and thank you to the health department for leading the way and guiding us through this pandemic. I've said it before, and it's been said by many other leaders in the community. It's going to take everybody. It's a matter of personal responsibility. We have to follow protocols. And I know I'm speaking for our students when I say the harder we work at maintaining our personal responsibility with regard to this virus, the better our chances for our students to get into a season, complete a season, and hopefully give us an opportunity to get all of our students back in school. So appreciate very much the opportunity.
Good afternoon. I also want to say thank you very much, Mayor, for allowing me the opportunity to speak this afternoon. In our high schools, we value extracurricular activities, in part because of the valuable lessons that are so readily taught and learned in a team setting. Kids learn that the whole is more important than the individual. They learn that doing fundamental things is necessary to succeed, that perseverance, sacrifice, and discipline are key to success, that you play by the rules that are set before you. And kids learn how to respect themselves, their teammates, their coach, and those who oppose them. It is striking to me how these same lessons apply to our community during this pandemic. I know I speak for other administrators in the county when I say that I supported the decision 3 weeks ago to postpone the activities, postpone youth sports. I supported it because I trust the people who made the decision. And I know their concern has always been for the safety and well-being of our kids, our teachers, our coaches, and our community. Having said that, I'm also very grateful for the work that they have done with the administrators and athletic directors of our community schools these past few weeks to find a way to allow these activities to continue. We and they believe that high school sports can continue because of the protocols that we have in place. As I highlight some of these protocols at Pius, I want to emphasize that while some of the fine details might vary from one high school to the next, there are 4 key principles that are the same. And before I outline these principles, I want to emphasize that these same principles and some of the same protocols have been in place since fall sports began. However, we've had to conduct a thorough review and enhance these protocols as they pertain to indoor activities and the recent increase in COVID in our community. The first key principle, of course, is to keep the virus out as much as possible. If the virus can't get into our schools and into our activities, we are way ahead of the game. We screen every participant for temperature and conduct symptom questionnaires of all athletes before every practice or every game. We regularly remind our kids to stay away if they aren't feeling well. You'll likely find this hard to believe, but I was once a high school and college athlete. I used to think the heroic thing was to fight through the illness and attend practices every day. In this environment, the heroic thing is to stay home and to avoid infecting your teammates. The second key principle is to practice social distancing whenever possible. We have places marked out for our athletes to sit before and after every practice to make sure that they are practicing proper social distancing. Our coaches have altered warm-up and stretching routines to make sure that kids are separated as much as possible. When kids are waiting in line for drills, we are expecting them to maintain distancing when not masked. This leads me to the third principle: wear a mask whenever possible. There are definitely times in games and in parts of practices when athletes actively engage in competition are unable to wear masks. I think especially of our swim team. However, before and after practice, during team meetings, during some drills, or when sitting on the bench, these are all times that masks can be required. Finally, the fourth principle is to practice good hand hygiene. Whenever possible, athletes don't share equipment. In cases where athletes do have to share equipment, we take extra care to sanitize the equipment at least before and after each practice. We have hand sanitizer readily available before, during, and after practices. We eliminate unnecessary contact with opposing coaches and players, such as pregame and postgame handshakes. We at least daily disinfect our locker room surfaces. These four principles are, by the way, the exact same principles that have made it possible for us to provide 100% in-person instruction this whole semester without an outbreak of COVID at Pius X High School. They are the same principles that will help our community against the pandemic, but it takes everyone buying in. I will end with a plea to the Lancaster County community that we follow the game plan of Coach Gaylor Baird and Coach Lopez, and as a team, we work together to defeat this opponent. Thank you.
Thank you so much, Mr. Korda, and thank you, Dr. Joel, for your leadership and all of the folks you work with who have collaborated to allow for a safer return to the game and to activities. It's what we all want. And if we want them to continue to finish out their seasons, we all have the ability to help. And that's by practicing these public health measures ourselves in our daily lives so we can protect our kids and their opportunities. In the meantime, with the holiday season upon us, we hope that everyone's getting in the spirit and is taking a look at their opportunities and choices when it comes to holiday shopping. We want you to shop local. That is so important to help our businesses and our local economy and help us continue to recover and renew our community in the wake of this pandemic. This holiday season is about giving back, and Lincolnites can give back in so many ways throughout this year. And this year, as we hunt for those last-minute gifts, please remember that the greatest gift that you can give during this season of celebration is to support our healthcare workers, our businesses, our educators, our children, and our community by wearing a mask, washing your hands, watching your distance from others. Let's stay in the giving spirit these next few weeks and give the gift of a healthy community to one another. Our numbers are at an all-time high, and our healthcare professionals are strained. Let's give them the best gift we can and do our part to stop the spread. And with that, we will open up for questions from the media.
Mayor, this is Bill with 1011.
Hi, Bill.
I think my question is probably for Pat.
All right, she'll be right here. Director Lopez?
Hi, Bill.
Yeah, hi, Pat. Talking about the positivity rate this week at 36%. Last week was the old record at about 29.5%. What does a 36% positivity rate say about the spread in the community?
Well, it's very high, but remember, Bill, we're not quite finished with the week, but after our number of cases today, I'd be concerned that it probably won't go down much, but that positivity rate is telling us that we have high spread in the community.
Does it mean that there are a lot of probably undiagnosed cases as well? We've heard from national experts that high positivity rates tend to mean there's a lot of uncontrolled spread and a lot of undiagnosed cases.
I'm not, we haven't found any evidence about that, about the undiagnosed cases. But what it means is we have a high volume of people being tested and a high number of people being positive. And at Test Nebraska, for example, we at Bryan drive-through, we average about, between the drive-through and the other urgent cares, probably 225 tests a day. And through Test Nebraska, another pod is being added today, so that they'll have 4 lanes of testing, and they're increasing their testing to 1,000 tests today. So we've added more tests, but we also have more people that are symptomatic when we're talking to them and going in to get tested.
Do you think we're starting to see the effects of Thanksgiving yet, or that is still a few days away?
I think we could possibly be getting to see the very tip of it, but I think we'll see more in the next few days, Bill.
Director Lopez Riley at the Journal-Star. What's the status and how would you describe what's going on with the long-term care facilities right now? And do you think that the record week we've had with deaths is likely peaked, or where does that trend line go?
We have seen additional cases just this week, and we're working closely with those. We're going to be watching really closely, Riley, over the next few days to see if we've peaked. But since November 15th, 36% of our deaths have been from long-term care. That's the highest number that we've had. In general, we've had very little exposure going on in long-term care. But we have to remember that the people who are going in to take care of the residents are the people in our community. So that goes back to what we've said about why it's so critical that we all do what we can do to prevent the spread, because we're infecting the people that are going into the long-term care, that are the people taking care of them, so then they're not able to work, and we're also spreading the disease among the residents who are some of the most vulnerable in our community.
Do the long-term care facilities, obviously your staffing point well taken, but did they have what they need to protect their staff and residents, or are PPE supplies in jeopardy at all?
No, Ryan, thanks for asking that. It's an opportunity to share that. We work very closely with all the long-term cares. We actually have an automated process for all of them to reach out to us to order what PPE they need. If they have needs that we currently don't have available from our cache, then we go out and we seek what is needed and we get it to them. We work really closely with the Healthcare Association, who also assist us in working with the long-term cares. Our long-term cares and assisted living do great communication with us, and we have a very supportive community that really wants to do all the things right and do them as they're needed. So we are able to get them the PPE, we're able to get them the testing supplies that they need, and we provide whatever additional support they need. It involves me calling the chief medical officer to get something that one of our facilities need. That's what we do.
Had an additional question about compliance with the DHM. So it's been some time now since the bars and restaurant restrictions went into play with the latest DHM. What level of compliance have you received, and can you address the tickets issued to the office, gentlemen's club, and the night before lounge?
You know what, I'm going to ask our city attorney, Johansi Christie, to address that.
Hi, Riley. If you could just ask the question again, please.
Yeah. So how are the cases or the violations at the two gentlemen's clubs that have been ticketed by the city? How are they discovered? And could you speak to the level of compliance with bars and restaurants to the latest DHM?
Well, I don't know that I would get into the specifics of the criminal complaint, but I will tell you that a lot of times, well, all of the times, it's in response to complaints. And so when we get complaints, we will react accordingly. Also, the LPD Health Department, they do routine checks as well. That's been going on, before COVID. So that's always been in place. And then again, respond to complaints as well. And I think in response to your other question, just generally speaking, I don't have any problem saying that I think compliance has been good. I think that overall, I think the community is trying to do what's best for everyone, and that would include the bars and restaurants.
Are there any further questions from the media? We have both our educational leaders here still as well, if you have questions for them. All right. Well, seeing no further questions, thank you so much for tuning in to this briefing. Please have a safe and healthy weekend and look after one another. Thank you.